Talking about intimate health is a taboo in our society. Urine leakage is a common problem resulting from aging, post-pregnancy and menopause in females. In fact, every third person in our society is suffering from urine leakage problem. But nobody has the courage to discuss this even with their peers. People are spending more on the adult diapers than the newborn diapers. They suffer a lot from physical and mental stress because of the constant urine leakage. But they are reluctant to spend either time or money on their health. So, urinary incontinence is truly an underdiagnosed and underrated problem in our society. This worsens with time and people often ignore it. Hi everybody, I'm Dr. Deepthi Asthana, practicing gynae consultant in Kalosa Cosmetic and Gynae Clinic, Gurugram. And today I'll be discussing about urinary incontinence problem and the treatment options which we have. In this condition, a person can have sudden urge to urinate or person can leak when there is any condition which leads to increased abdominal pressure, which may be laughing, sneezing, coughing, gymming, etc. Now this is not a disease, this is a sign of some underlying problem. People may just pass a small amount of urine or the urine may soak through their clothes. Now let us see what are the types of urinary incontinence. We can divide urinary incontinence into majorly 4 categories, which is stress incontinence, urge incontinence, mixed or overflow urinary incontinence. Now let us talk about stress urinary incontinence. Stress urinary incontinence, it occurs when the urethral sphincter or the pelvic floor muscles, they become damaged and cannot hold back urine. When the patient is doing any physical activity that puts pressure on the abdomen and hence that pressure goes to the bladder and hence leakage occurs. Now people who have mild SUI, they may leak when they cough, laugh, gym, etc. But the people who have severe stress urinary incontinence, they may leak while standing or bending also. Now people who are more prone to stress urinary incontinence are the females who give childbirth, because childbirth leads to damaged nerves and also weak pelvic floor muscles. Also, people who are aging, they are more prone to stress urinary incontinence as they have weak pelvic floor muscles and weak urethral sphincters. Now let us discuss what is urge incontinence. Urge incontinence, it occurs when the patient has sudden constant desire to urinate even when the bladder is not full. Now there are many reasons when urge incontinence can occur, namely when there is any damage to brain, spine or nerves, when there is any neurological disease, when the patient has diabetes, any stone, any irritating substance in the bladder, any infection in the bladder, or there is any blockage in the urinary tract passage, which could be because of prostate hypertrophy. Now we'll see what is mixed incontinence. Now when the patient has symptoms of both stress as well as urinary urge incontinence, we call this mixed incontinence. Now coming to the last category, which is overflow incontinence. This occurs when there is weakness in the bladder muscle and there could be any blockage in the urethra. Now let us see how does urinary incontinence affect the lifestyle of the people. People who have urinary incontinence, they just want to sit at home. They avoid any kind of social gatherings or they just want to go to places where toilets are accessible. They avoid any kind of physical activities. They don't want to go to gyms or they don't want to run. People also spend so much on their diapers that their pockets become very heavy. Also, because of the constant urine leakage, people go into depression, low self-esteem, and because of the embarrassment of attending social gatherings, because of the urine leakage, because of the urine odor, or of constant running to the toilets. There's also less physical intimacy between their partners because of the urine leakage. Now let us see what are the treatment options available to treat urinary incontinence. Since long, we have been doing surgeries to treat stress urinary incontinence. Now, every patient is not ready to go under the knife, especially the elderly ones. and also failures of surgeries are not uncommon. For urge incontinence, we have medical management, but this is also a long-term management and not free of side effects. But now we have something very new, very revolutionary, which is BTL-EMSLA, which treats both stress and urge incontinence in patients. Now what is BTL-EMSLA? BTL-EMSLA is a US FDA approved machine for both male and female incontinence. It uses HIFEM, which is high intensity focused electromagnetic energy, to deliver Kegel's contraction to the pelvic floor muscles. It delivers around 11,000 Kegels in just 28 minutes. Now these 11,000 Kegels are lifetime of Kegels anybody can do. BTL-EMSLA is a completely painless treatment. Patients can feel some kind of vibrations through their body, but that is easily tolerated by each and every patient. It's a completely walk-in and walk-out procedure. In fact, we call it a coffee break procedure. There's no downtime and patients can start feeling the results even from the first sitting itself. BTL-EMSLA is a US FDA approved machine for both male and female urinary incontinence and also is backed by many clinical studies, so patients should not doubt about their safety. BTL-EMSLA is a completely non-invasive machine. Patient has to just come and sit fully clothed. In fact, we are the first ones in Delhi NCR to bring this technology, and in case of any doubt, you can come and visit us at Kalosa Clinic, Gurugram. Now let us see who are the ideal candidates for BTL-EMSLA. Any female who's active otherwise but suffers from urinary incontinence is an ideal candidate for BTL-EMSLA. Any female who's postmenopausal or elderly, any male who suffers from incontinence can have mild prostate hypertrophy or post-prostatectomy when he suffers from urinary leakage. Any new mom who has delivered 6 months back is an ideal candidate for BTL-EMSLA. People who are having trouble in their intimate relationships are also ideal candidate for BTL-EMSLA. Now coming to mommy makeover surgeries. How are mommy makeover surgeries special with us? At Kalosa Clinic, we are following a holistic approach to the whole mommy makeover process, along with liposuctions, breast lifts and abdominoplasties, which are done by our in-house plastic surgeon, Dr. Ashish Khare. We are also treating all patients with BTL-EMSLA, which take care of their urinary incontinence, and also we are offering them vaginoplasties to take care of their loose vagina. So anybody who feels they need mommy makeover, kindly feel free to reach out to us. Thank you.
Kalosa Clinic is a fantastic place. It's been a godsend for me. I've had this incontinence problem for the last 4 or 5 years and I was quite desperate, didn't want surgery. And when I saw the advertisement on Facebook, I was skeptical about it, thought it was a gimmick. Then I found that the cost was not too high, I could go in for it. After meeting Dr. Deepti Asthana, I was quite convinced because she had a tone of sincerity in what she said. And the fact that she did not profess that it would be a miracle, I think I was convinced by that. And after the first 2 sessions, I found remarkable improvement. And today is my last session. And it's been a very good session, and the entire thing has been very good. And I would advocate it for all women post 45-50, and we all go through the same common problems which we are scared to talk about in public. I don't mind saying that this has helped me, and I hope it will help others too.